in the health and fitness world, or particularly fitness, it got real popular in like the last 5 years to talk about hormones. And I think for many reasons, and I want to dig into that a little bit, but in the coaching industry, it particularly got hot, and there were people trying to maybe practice even outside their scope of practice in giving people advice or making assertions based on very limited information or very limited data or very limited knowledge or education. And it got a little dicey there for a while. And I remember this going, hey, this is a slippery slope. However, I think there were some positives that came out of that, because it brought a high level of awareness to the fact that it's not all black and white. It isn't just about the food we eat. It isn't just about the exercise we do, that this is a very complex system, and that yes, there could be some underlying issues there. And it also came full circle to, while people were trying to put, well, it's your thyroid, you got a thyroid issue, and a lot of, on the other side, it's like everybody's blaming their thyroid for everything. But what it came out of it in the end, I think, is stop blaming your hormones, and let's take a harder look at your lifestyle and your behaviors as a whole, and how that might be impacting your hormones. And yes, thyroid obviously is a major part of the system, a key component of feeling healthy, looking healthy, living vibrantly, and all of those things. So let's dig into that. Let's dig into thyroid and talk about maybe, just for those who may not know, or maybe think they know, we might clear some things up for them. Maybe just overview thyroid and the function of the thyroid.
Absolutely. It's kind of like you mentioned, our systems don't work in a vacuum. Everything works in connection with other pieces. And so, look at thyroid function. Yeah, we talk directly about thyroid function, but there's a lot of other pieces that have inputs to that. And so as far as thyroid, looking at thyroid function, a lot of people, want to focus directly on the thyroid gland itself, but so much of it has to do with the signal from the brain, right, to the thyroid and to the adrenals and the reproductive system and all of that. And as far as thyroid function goes, when we look at, let's talk about, maybe, I know we're going to get into maybe a little bit more detail about labs, but just kind of give an idea of what that looks like is, when we look at reference ranges for labs, they're using a particular population for that. Right. And we know that most folks are not going to feel well, even if they're within range on some of those. So we have to look at optimal. And so function, when we look at thyroid function, just because somebody's within range does not mean that their function is what it should be. Mm-hmm. And the thyroid is responsible for so many things. And I think that's why it became kind of a scapegoat, like you mentioned, is because it does a lot of things. It controls our metabolism. It regulates our body temperature. It make sure that we have good energy. It makes sure that we have good bowel movements, all sorts of things. Even how dry or not dry our skin is. It has to do with so many different pieces, and that's why it's an easy fallback. But a lot of times it does start with that lifestyle piece. And I think I even did a post on this at some point where it's like, okay, is it a thyroid disorder or is it a lifestyle disorder? Because you could be in a not optimal range for your thyroid, but that could be an easy fix, just eating the right foods and moving your body and getting adequate sleep. And you can correct your thyroid function that way without taking a pill or even taking a supplement. So thyroid has widespread effects on the body. It controls reproduction. So for women, their menstrual cycles, it could be a thyroid issue there. So it controls a lot of different things, a lot of different parts of the body.
Yeah. So can we actually get into that part just with regard to female hormone balance, specific to sex hormones and thyroid function, or just, maybe a downregulation or upregulation of thyroid as it affects those hormones? Because as we know, it's undisputed now, as we get older, estrogen levels for females as you get older are supremely important for heart health, for bone health, and many other things. But maybe just walk us through kind of the interplay between sex hormones and thyroid.
Yeah, absolutely. So, it's all part of the endocrine system. And I think too, cortisol and adrenal function has to be tied into that as well. I think if we leave that out, we're missing a piece, because if you think about kind of where our world is right now, everybody is stressed. Everybody is just kind of living on the edge there and not feeling their best, low energy, not sleeping well, just stressed out. And that impacts a lot of different things. So oftentimes what I'll see is that somebody has major stressors, or like a long-term stressor, or a couple of big stressors. And then that starts to, because that's a brain function, right? It's what we call the HPA axis, or hypothalamic pituitary axis. And that's the same, along that same axis is where our thyroid function is. So if you have chronic stress, that's going to affect thyroid function, and that chronic stress will also play into our sex hormones. In particular, one of the main patterns that I see is abnormal cortisol, and then down the line, low progesterone. So by the time people come to me, people are used to being tired all the time.
Stressed out.
The norm for folks. Yeah, it shouldn't be the norm, but people are like, I'm tired. Everybody's tired. That's not unusual. But by the time they come to me, okay, well now they have, if they're premenopausal, they'll have heavy periods, painful periods. Their OBGYN put them on birth control, right? Which just downregulates all of that stuff, which is not helpful. And so usually what I'm seeing is that by the time they come to me, they have abnormal periods. I find that, okay, your progesterone's low. I know you mentioned estrogen, that tends to happen closer to perimenopause and menopause. And I have a lot of those folks too, but progesterone's a big piece of it. And so we have to, it's kind of, where do you start on that pathway is one of the arts of what I do is, okay, do we start with correcting your progesterone, or do we tackle your, adrenals first, or do we tackle your thyroid, and kind of finding out where to manage all of that. But yeah, estrogen is supremely important for our bone health, for, some of the, obviously hot flashes in women. If estrogen's low, that's out of control. But progesterone and testosterone, a lot of people don't think about testosterone for women, and I have found that to be key for a lot of them in terms of managing their joint pain and making sure they have a great libido and stamina. So the hormones are very closely tied in because they're all part of the endocrine system. And so they all play on one another. If you have an imbalance in one area, for sure you're going to start to see an imbalance in the other areas. They all work together.